We're going to go over the Luo points today. So we're going to talk about the characteristics of the Luo point. The Luo point connects with this paired channel, which means if we're talking about the lung, it's paired with the LI. If we're talking about the stomach, it's paired with the spleen, and that's because it's in the same element category. Lung and LI, it's in the metal category, and spleen and the stomach is in the earth category. And then it continues to follow the pathway. The function of the Luo points, it connects the superficial and the primary. Now, what does this actually mean? If we go up here, see there's 6 levels. The most superficial is 1, and of course the deepest is 6. So that's the order that it goes. This is a division line of where it divides the very superficial layers and of course the deepest layers. Now the Luo actually behaves like a liaison where it connects the superficial, right, from to the primary. And so that's why we actually say that definition. Now we're gonna go over the Luos. So Luo, there's actually 15 Luo points. Now how do we get that? There's 12 in the primary, then there's the Ren and the Du, which is 2. And then we have one more, a special one. It's called the Great Luo of the Spleen. So if you recall this, it'll be 12 plus 2 plus 1. And that's how we get 12, 13, 14, and 15. So that's why there's 15 Luo points. Now the Luo point of the lung is lung 7. It goes and spreads to the thermal eminence, you see right here. It is superior to the stylic process of the radius. So the radius means you know where the thumb is. We probably can all feel the styloid process, right? It's superior to that. And then 1.5 soon up from the transverse wrist crease. And that's where lung 7 is. Now, majority of the time, where the Luo point trajectory goes to pretty much tells you what this Luo point addresses. For example, here, it addresses heat sensation at the wrist and the palm. That makes sense, right? If you see the picture right here. But it also addresses shortness of breath. The way you can link this is that, you know, the lungs, right? So shortness of breath, it kind of goes together. But that's what it helps to address. The Luo point for lung 7. Now we have LI 6 as the Luo point for the LI. It travels to the teeth and ears. So this one actually goes up from LI 6. It divides onto the cheeks and the ear, but usually we say the teeth and the ears, okay? It's at the radial side of the arm, right here, line between LI 5, LI 11, but it's 3 soon up from LI 5. And of course, just like I said before, because it goes to the teeth and ears, LI 6, it addresses toothache. Now we have stomach 40, which is also the Luo point for the stomach. It travels up to the neck and the throat area, if you see right here. It's 8 soon up from the tip of the external malleolus, lateral to stomach 38, 2-finger breath. So as you know, the leg from the knee to the malleolus is 16 soon. So technically, you can actually say from the eyes of the knee, you can go 8 soon down, or you can say 8 soon up from the external malleolus. But you have to recall that although from 36, it's 1 soon finger breath, right? For stomach 38, it's 2-finger breath. If you remember 36, 37, 38, 39, and then 40, you go up here. So that's why it's 2-finger breath. And of course, because it goes to the neck, it addresses sudden hoarse voice. Now for the spleen, the Luo point for the spleen is spleen 4. It goes to the stomach and intestines. It's in the depression distal and inferior to the base of the first metatarsal bone. So the first metatarsal bone, it's distal and inferior. And it's the junction of the red and white. So you know that this is below the bone, okay? Because it also says inferior, and it's distal to it. And it's the junction of the red and white. Now this one addresses severe diarrhea and dehydration. You can link these symptoms back up to where spleen 4 travels to, which is the stomach and the intestines. We have Luo of the heart, which is heart 5. It travels to the tongue and eyes. This is also very true when you study the pathway of the heart. It goes to the tongue and eyes, okay? Pretty much we say that the tongue is what speaks from the heart, right? So we use the tongue to speak what's from our heart. And we see our heart through our eyes, right? We say windows to the soul. We use that term. So it applies here as well. It is at the radial side, right, of the flexor carpi ulnaris. I always mention this. Ulnaris always has to do with the heart. And it's one soon up from the transverse wrist crease, which is right here, one soon up. It's in the radial side of the flexor carpi ulnaris. And that's how you find heart 5. And of course, just like it addresses, because it goes to the tongue and eyes, it addresses aphasia, which is language disorder, inability to communicate. So that goes also together. Now, the Luo point of SI is SI7. It goes to the shoulders, or approximately around where LI15 is. It's at the line from SI5, right, and SI8. 5 soon up from SI5. And that's where SI7 is. Like I said before, usually it addresses, you know, the condition depending on like where the trajectory goes for the Luo points. Here it addresses skin warts. Although it goes to the shoulders. Now the only thing I can think of is that, you know, the metal element has a lot to do with the skin. So in here it says that it kind of connects to the you know, the LI15 area, which, you know, Li happens to be the metal element. You can kind of link it like that and say that's why we address skin warts with SI7, the Luo point for the SI, okay? The Luo point for the UB is UB58. This one travels to the kidney on the leg, okay? So UB58 is 7 soon up from UB60. We know that UB60 is actually parallel to the lateral malleolus, right? But we have to also remember it's posterior border of the fibula. So posterior border of the fibula, 7 soon up from UB60. This addresses nasal obstruction, water discharge. I mean, the only thing I can think of is the relationship between the lungs and the kidney. And that's the reason why maybe we have nasal obstruction and watery discharge is what UB58 would help with, okay, or address. Now we have the kidney. The kidney travels to the PC. Kidney 4 is the Luo point for the kidneys. So kidney 4 is between kidney 3 and 5. Is posterior and inferior to the medial malleolus. So right here is posterior and inferior to the medial malleolus. It's in the depression medial to the tendocalcaneus. This you may want to know. Okay, this calcaneus happens to be by the foot area, of course, so that is the reason why this gets repeated a lot, especially for the kidneys. So this is a good landmark to know. And what does it address? It addresses the retention of urine. Okay. You have to also see that it not only goes to the pericardium, by the way, it actually spreads to the lumbar vertebrae. So just remember this, even though it's not written here, because when we look at the book, it actually says that it goes to PC and lumbar vertebrae, but usually we say it's the PC. But it also helps with the retention of urine. So you can think of it as, you know, as you get older, you're less likely to be able to, you know, hold your urine, okay? So you can think of it as that, and so that the Luo actually addresses that, okay? Or that there's a, you know, a relationship imbalance between the fire and water, and so that's why the retention of urine can also occur. You can think of it that way, and so that's why the Luo of the kidneys 4 can address retention of urine. Now we have the Luo of the PC, which is PC6. This goes to the heart. Is too soon up from the transverse wrist crease between the two tendons right here, palmaris longus and flexor carpi radialis. As I said, radialis always points to PC. And of course, because it goes to the heart, it addresses cardiac pain or restlessness. Now we have Luo of the Sanjiao, which is Sanjiao 5. This one also travels to the PC, okay, just like the kidneys. It's too soon from the Sanjiao 4, right, between the radius and the ulna, right here. And this one actually addresses cubital joints. I'm not really sure what connection we can make here, but this may be one of those outlier ones. Now we have GB37 as the Luo point for the GB. It travels to the dorsum of the foot, if you see right here. It's 5 soon up from the tip of the external malleolus. Okay, 5 soon up. Anterior border. Now, as I said before, 5 and 9 works behind the desk, so that applies to GB. Since this is not 5 or 9, it's always what? Anterior border of the fibula. In other words, the front of the fibula bone, not behind. Okay, and of course, because it's at the dorsum of the foot, it's where it travels to, the Luo point GB37. It addresses coldness at the feet, paralysis of the lower limb, and inability to stay erect. So it addresses all these things. You can think of it as a GB is like the element wood. So, you know, get your wood up in the morning and ability to stay erect. So you can think of it that way. Paralysis of the lower limb. I mean, it happens to be on the lower leg. And, you know, when you think of the wood element, we think of the tree trunk. So you can think of it as paralysis of the lower limb. Okay. Now the liver. The Luo point of the liver is liver 5. It goes to the genitals. There's a very big association between the liver and the genitals, even when you study the liver pathway. So this is actually very easy to remember. It's 5 soon up from the medial malleolus, okay, on the midline of the medial surface of the tibia. So fibula is always the bone that addresses with the gallbladder. Tibia is always with the liver, okay? But it's in the midline of the medial surface, but it's 5 soon up from the medial malleolus, okay? And of course, because it goes to the genitals, it addresses descending pain, pruritus at the pubic region, swelling of the testes, and hernia, okay? Now we have the Ren. The Luo of the Ren is Ren 15. It spreads to the abdomen. It's below the xiphoid process, right? 7 soon up from the umbilicus. So this is the umbilicus, 7 soon up. It's below the xiphoid process. Xiphoid process. And of course, because it goes to the abdomen, it addresses descending pain, pruritus at the abdomen. Okay. And then we have the dew. Dew's Luo point is dew 1. It spreads to the spine and the occiput, which is right here by the head, and the spine right here. It's going to be the midpoint of the agnus and tip of coccyx. So this is where dew 1 is. It's the midpoint of that. Okay, the anus and the tip of coccyx. And it travels up the spine and the occiput. And so, of course, because of, where it spreads to, the luo of the dew 1, it addresses stiffness of the spine. Now we're on to the last one, great luo of the spleen, which is spleen 21. It spreads to the chest and the ribs. If you see where the location of spleen 21 is, it's right around your armpit, right? And it goes 6 soon down to the side, right, of your rib area. And so because of that reason, you can say it goes to the chest and ribs. It's pretty much the same pathway, similar pathway as where the point is in the pathway of the spleen. So we actually say it's at the mid-axillary line, 7th intercostal space, okay? That's where spleen 21 is. And it addresses aching and weakness of the joints and forelimbs. So I don't know about the joints, but at least we know that the spleen, there's an association to the forelimbs. So you can consider that the great luo, or the spleen 21, addresses aching and weakness of joints and the forelimbs. And that it's, it spreads to the chest and the ribs. And so that is the review of the luo points. I hope that was helpful.